Hi everyone, and welcome to this edition of Comet Conversation. And today's program is focused on our Med-Tech program here at Steele High School, and we're joined by Kim Haney, who is our instructor, and Madisyn Baker, who is one of our seniors in the program. First of all, thank you so much for joining us.
Thanks for having us
on today's program. And I wanted to talk a little bit about the Med-Tech program, and a lot of our viewers may not realize or may not be familiar with this program and really how unique it is, not only in Lorain County, but in this part of the state. So Mrs. Haney, maybe you could start out by just sharing a little bit about the program, maybe providing an overview in terms of how many students are enrolled, what the program is all about.
Sure. Well, we're going into our 21st year, which I can't believe we've been around for 21 years doing this. But basically the Med Health Tech program, our focus is preparing students to pursue post-secondary options in healthcare, allied healthcare in particular. And I break it up into three domains. The first one is we address academic challenges or academics in general, where I have articulated and I teach college courses from LCC here on our campus. So MedTech is comprised of 13 different college courses, which equal about 29 college credit hours.
That's incredible.
Some are CCP, some are articulated. So so the students get that academic challenge, again, to pursue or rather explore careers in healthcare. And then we look at leadership aspects, developing leadership skills within the program, working on soft skills, which is one of the things I hear a lot from people in the community and my networks, in healthcare, where okay, you may have the academics and the smarts, but being able to convey that and bring the human and humane in healthcare. So we work on programs with that and outreach and that sort of thing. And then the last is the hands-on learning. Currently today, I've got students out doing service learning. So we're at the free clinic, we're at Amherst ER, we're at Amherst Manor, where we're out with patients and seeing if it's in different populations, from pediatrics to geriatrics to the main population, and deciding, so what it all comes down to is, do you want to go into healthcare or not?
Right. And it is such a great opportunity for students to have that experience here at the high school level. I mean, it's absolutely incredible to find out, is this a career, that I want to pursue? And of course, everything that we're hearing is the healthcare field in general is a great path to go, as I understand it.
Right, and it has to come from the heart. Yeah. You don't go into healthcare for a paycheck, although that may be the initial draw, and it doesn't hurt. But you have to have a heart for it.
Right.
And that's the thing, these experiences that I provide the students, I try and give them a story.
Yeah.
And reasons to do what they want, to pursue healthcare, and even like the interviewing process to get jobs, or the interviewing process to get scholarships or get into a college. Part of that is you're sitting there, at University of Cincinnati, to get into the nursing program. They interview you,
right,
and they'll ask you, why do you want to go into healthcare? Well, I like to think, and I've been told, my students say, witnessing these they come out with stories. They can say, well, when I was at Amherst Manor, I worked with Parkinson's patients, and that inspired me to go into nursing.
Just firsthand experience.
Firsthand experience, and they don't get that at this age.
Yeah.
But we try to give them these experiences to motivate them.
It's a great thing. And Madisyn, I'm just kind of curious to hear from your perspective. I guess a two-part question. Why did you decide to enroll in this particular program? And then maybe what has been the one thing that maybe you've learned the most or you've enjoyed the most about the program?
I first enrolled because I've always been interested in the medical field, whether it's dealing with one thing or another. But I've always wanted to go into it, and it's nice because being in it, you not only whether you're interested or you think you are, and then you go out and you do stuff and you learn if you're not. So like you learn everything that you've always liked, but then you also find out things that you don't like. So it kind of helps you determine whether you thought you liked something and then you kind of go into a different path. So it's a bunch of different directions, and you always find something new every single day.
Yeah. Well, and there's so many different career paths that are available, and I'm just kind of curious, Madisyn, what are maybe some of the things that you're considering as you look to the future as a result of your experiences in this program?
So at first I wanted to go into nursing, and then after last year, junior year, I did a visit to the physician's office and kind of just seeing what they do, and then I also got to witness C-section pregnancy. So I got to see that, and then that kind of made me, I kind of wanted that authority that a physician has. I kind of wanted everything that they're able to do. So it kind of steered me away from nursing. Well, then I know that I for sure want to go into emergency medicine. So now I'm kind of on the edge between a nurse practitioner or the physician side. So just kind of, because nurses are always.
Well, I'm sure that no matter what it is you choose, you will do a great, great job.
Thank
you. Again, thank you so much for joining us today. And I'm just kind of curious, Mrs. Haney, anything in closing that you would want to share about the program or would want our viewing audience to know about the program? Anything at all?
I really can't thank the community enough. When I send my students out to the community, they welcome them.
Right.
We're in all the hospitals in the area. We work with the health department. We work with private practice. I mean, they help fuel this program, and they trust us and they believe in us. So I can't thank the community enough. The administration giving me the freedom to pursue these avenues and these networks, and so I'm very, very blessed and very thankful. I've got great students, and that you got good students. It's
Absolutely.
easy to teach it. They come in motivated and ready to learn, and every once in a while I need to pull them over. I've never had to do that with Patty. But I'm very fortunate. A great program, great students. Again, the administration has always had my back, and the community. I can't thank the community enough.
Well, thank you so much, both, for your work with the program and Madisyn enrolling in the program. It's a real source of pride here, not only in our school district, but in our community. And again, there's such a healthy partnership that's been developed, with various folks in the community to make this program what it is. So again, thank you so much, and we look forward to future updates.
We are too.
Thank you. Thank you again. And in closing, thanks most of all to you, our viewing audience, for your support of all of our educational programs here with the Amherst Schools. And if you ever have any questions, comments, or concerns, please feel free to give me a call at the board office. That number is 440-988-4406. Thank you so much, and go Comets.